EKG NCLEX questions. Question 1. A 38-year-old female is brought to the emergency department with complaints of her heart beating out of her chest. She is diaphoretic, tachypneic, and her blood pressure is 70/40. The cardiac monitor shows supraventricular tachycardia. Valsalva maneuvers and 3 doses of adenosine have not been successful. What should the nurse do immediately? Prepare the patient for synchronized cardioversion. Give epinephrine 1 mg intravenously and repeat in 3 minutes. Give adenosine 6 mg intravenously per protocol. Perform unilateral carotid massage. Since the patient is unstable with a low blood pressure and has not responded to maneuvers or medications, synchronized cardioversion is the next priority. Question 2. Prior to discharge from the emergency department, the nurse prints a rhythm strip and notices that the P wave cannot be detected and the QRS complex is 0.24 seconds. This is a change in the patient's condition. What is the best action for the nurse to take? Measure the PR interval. Prepare the patient for discharge. Notify the physician of this abnormal strip. Continue to monitor for abnormalities. A wide QRS and absent P wave indicate a significant change in heart rhythm. The physician must be notified immediately to address the potentially unstable condition. Question 3. A patient is to have synchronized cardioversion for treatment of atrial flutter. He has received heparin 500 units subcutaneously. Which of the following interventions should now be performed? Assist the doctor in intubating the patient to stabilize the airway. Sedate the patient with Verse 2 mg intravenously push per protocol. Set the defibrillator in asynchronous mode and charge to 300 joules. Steadily increase the voltage until the beats are captured. Cardioversion is a painful procedure, so the patient should be sedated beforehand. Synchronous mode is required, and intubation is typically not necessary. Question 4. When a patient has long-term atrial fibrillation, which drug would the nurse expect to include in the plan of care to minimize the greatest risk commonly associated with this condition? Beta blockers, digitalis, anticoagulants, antiarrhythmics. The greatest risk in long-term atrial fibrillation is the formation of blood clots, which can lead to a stroke. Anticoagulants help prevent these complications. Question 5. Which of the following treatments for second-degree type 2 AV block would be appropriate? Temporary pacemaker insertion, atropine if symptomatic, and coronary stent placement. Close monitoring without intervention and carotid massage. Synchronized cardioversion and an implantable defibrillator. Adenosine 6 mg and unilateral carotid massage. Type 2 AV block can progress to complete heart block. Temporary pacing, atropine, and addressing coronary blood flow are appropriate interventions. Question 6. Which of the following would the nurse expect to be the first choice to treat a stable patient with ventricular tachycardia? Amiodarone, procainamide, synchronized cardioversion, atropine. Amiodarone is commonly the first-line medication for treating stable ventricular tachycardia. Question 7. A 21-year-old female is seen in the emergency department for vomiting and diarrhea for 3 days. Her blood pressure is 94/64 and her EKG rhythm shows sinus tachycardia. What is the best initial action for the nurse to take? Request pain medication for the patient. Cardiovert the patient immediately. Give adenosine 6 mg intravenously push. Start an intravenous line and bolus normal saline per protocol. The patient's tachycardia is likely a compensatory response to dehydration from vomiting and diarrhea. Rehydrating the patient with fluids is the initial priority.